Dr. John Fioramonti in from the Towson Veterinarian. Give me an idea. 2 dogs mixing. What should we as dog walkers do?
Well, 2 things. If your dogs are mixing it up with each other, you need to be careful that you don't try and get in the middle of it, because you can get hurt too. In the heat of the moment, you can get bit and you can get injured. So the secret is to try and stay back a little bit, try and use some shock techniques, screaming, making a lot of noise, whistling. I think with this kind of an incident that's going on, a lot of our viewers need to start paying attention. If you're going to take your dog to the dog park, you need to maybe bring a dog whistle, maybe bring a foghorn that you can make a lot of noise to shock animals with. What I like to do the most, and what my father used to always do, is he always had a large walking stick that he would walk with, and that would help him on his walks with the dog, but at the same time he had a long stick that if he needed to, he could try and separate animals with if something approached him. So think about having a nice walking stick, having a foghorn or some kind of apparatus that'll make a lot of noise and shock these animals so that they'll tend to stop and separate for a few minutes, and then you put them on command. Once you shock them and they startle for a second, you tell them to sit, stay. They may not listen to you, but you need to start getting on command quickly.
All right, we're going to take 2 calls, then we'll talk allergies. All right, let's go to Kate real quick from Bel Air. You have an English Bulldog, right, Kate?
Yes.
All right, and you have a urinary tract infection, is that what it is?
Yes, sir.
And you've taken it to the veterinarian, and they've checked the urine out, and they've got them on antibiotics?
Yeah, they have it on antibiotics, and they actually said that there's so many crystals that they think it might be forming, or that the crystals could form a kidney stone.
They could form a kidney stone or bladder stone.
Right.
So you need to make sure you have them on the right medicine. You also need to get them on a urinary acidifier. So there are some medications that your veterinarian can put you on that'll help acidify the urine. Cranberries will help do that. Tomatoes will help do that. So this time of year, if you want to feed your dog or your pet a lot of tomatoes, you can do that. Acidify the urine. Most of the crystals will go away. If they don't, there's some specific foods and things that we use to help do that.
Okay.
Let's go to David in Manchester. He's got an Airedale Terrier, ear infection. How bad is it, David?
It's pretty bad. The vet gave me medicine called Automax.
Right.
And I put it in his ear. It takes 7 drops for 7 days, and it clears it up. And about a week and a half, 2 weeks later, it's back again.
Okay, so what
and
you need...
I've been doing this for about 3 weeks, 3 months.
What you need to do, David, is you need to keep going back to your veterinarian every 2 weeks. He needs to use a scope to look down in that ear, because that dog's ear canal is in the shape of an L. It's really deep, and you may be clearing up the upper part of the canal, but not the lower. So you need to use the Automax, use that medicine, and every 2 weeks have the veterinarian use a scope to look in there to make sure everything's cleared up. Once everything gets cleared up, then hopefully you'll have a longer time in between infections, and that's the next thing we were going to talk about. Your dog probably, David, has some allergies, and he's doing a lot of scratching. He's scratching at his ears a lot, and if he scratches at his ears enough, he's going to give himself an ear infection. So usually dogs that have chronic ear infections have underlying allergy problems.
So what are you seeing as far as allergies?
Late summer, early fall is a time when we're seeing a lot of allergies. So your cats and dogs are going to be doing a lot of scratching and licking and pulling hair out. And if your pet is doing that, that usually is a sign that they've got an allergy. Their skin tends to itch and burn because their histamine cells in our pets are in the skin. Histamine cells in people are in our respiratory tract, so our throat and eyes itch, that kind of thing. But dogs and cats have their histamine cells in their skin. The skin itches and burns, and they do a lot more scratching. So if your pet is showing those signs and is doing a lot of damage to the skin, you need to get them on medications, get them on antihistamines. On a rare occasion, we use steroids to help quiet the skin, but we like to try and use antihistamines on a long-term basis to help control the allergies so that they don't have reoccurring ear problems and a lot of baldness, that kind of thing.
Good. You were really good today.
Thank you very much.
I wish I were home watching. It was very good.
We have it on tape.
Okay, good. All right, we're going to take a break and be right back with the rest of the show. Stay with us.